Hey, welcome back. Now, in our last presentation, it was short, but there was a lot of material presented on homocysteine metabolism, methionine, and how they're all folate and B12 dependent. You would do good to review that slide before you go on to this presentation. We're going to finish up with folic acid in this presentation. Okay, now, supplemental forms are folic acid and 5-methyl tetrahydrofolate. Now, when you take in folic acid, okay, it has to go into the methyl tetrahydrofolate form in order to be active. Your body normally does this. However, there are a certain segment of the populations which are MTHR, which is the enzyme that does that, deficient. And you can take in all the folate you want if you're MTHR deficient, and you're not going to make methyl tetrahydrofolate. If you have symptoms of folic acid deficiency and your folate intake is good, this is something we have to investigate, and it's more common than you think. Folic acid derives its name from the Latin folium, meaning foliage. Folic acid is widespread in green leafy plants. It's also high in brewer's yeast, legumes, and rice germs. So this is not an animal protein supplement. Diets high in animal protein, except for liver, provide very little in the way of folate. Folic acid has been shown to prevent neural tubes defects such as spina bifida. Remember, folic acid affects the development of the germinal cells, which are the embryonic cells which develop tissue. If you don't have enough folic acid in you, you could get things like spina bifida. To achieve this protective effect, folic acid must be given either preconceptually or within the first weeks of pregnancy. Very, very important. These prenatal vitamins that your obstetrician prescribes are very important, not only to protect you against neural tube defects, but to protect you against other defects in which vitamins are the cofactors. So take them, ladies. All right, folic acid abnormalities, this is very interesting, have also been found in cervical dysplasia. And remember, this is a precancerous state. It's evidenced by normal pap smears. And when you give the patient folic acid, the abnormal cervical cells normalize. Again, shown on pap smears. Very interesting. Folic acid insufficiency has also been associated with mood disorders such as depression, especially in the elderly. And frank folic acid deficiency presents as a microcytic anemia. Again, the term microcytic means that the red blood cells are small. If you recall, the anemia associated with B12 abnormalities is a macrocytic anemia, which means the red blood cells are large. Folic acid, as we have seen, is useful in managing elevated homocysteine levels. Finally, it should be noted that a dietary history of folate-rich foods is crucial in investigating folate insufficiency. Signs and symptoms of anemia may be present, like fatigue or shortness of breath or pale skin. All of these warrant investigation of your folic acid levels. You could have gastrointestinal symptoms such as diarrhea or decreased appetite. And all of you patients out there who are on anticonvulsants should be screened for folate insufficiency, as these drugs interfere with folate metabolism. So as you can see, ladies and gentlemen, vitamin B12 and folate, very, very important for us during our developmental stage and to maintain homocysteine metabolism, to maintain our brain function, our nervous system function, and to ward off any type of anemia. These are important vitamins, and remember, they're water-soluble vitamins, so the body takes what it needs and excretes the rest. All of you should be on these vitamins. Next time, we'll talk about biotin and go into the fat-soluble vitamins. We're getting to the end, ladies and gentlemen. You'll know more about vitamins than most healthcare practitioners. Thank you for tuning in.